Good evening, I'm Lisa Getter with a recent news bulletin before our regular Wednesday Nantucket Pulse episode. A few hours ago, the Highline Cruises Company announced they would start on March 19th to reduce the capacity of passengers their ferries carry. The goal is to encourage social distancing, whether it be on their boats or in line at the dock. This change will not decrease the number of ferries, nor will it affect pre-existing reservations. They encourage all passengers to buy and print out their tickets at home. Support for small businesses affected by the coronavirus is coming both from the federal and state governments. The U.S. Small Business Administration is offering up to $2 million in emergency loan capital, with rates capped at 3.75%. It is part of the Economic Injury Disaster Loan, the EIDL program. The state of Massachusetts is also offering up to $75,000 to Massachusetts-based businesses with fewer than 50 full-time and part-time employees. Non-profits can also apply. No payments are needed for the first 6 months, and there are no prepayment penalties before the loan matures in 30 months. The Chamber of Commerce recommends applying now because there's only so much funding. There is also support for employees whose place of work have shut down. The Department of Unemployment Assistance, the DUA, has waived the normal 1-week waiting period and will immediately pay out benefits to anyone making a coronavirus-based claim. Employees don't have to be actively pursuing work to receive the benefits as long as they are available to work for their primary employer. They are eligible for this program. If a business has to reduce an employee's hours, the DUA might cover them too. The Nantucket Chamber of Commerce is trying to support the business community here too. They have assembled a task force of individuals who represent the various industries on our island, and they met for the first time this morning. They focused on ways to help businesses survive the outbreak and cancellations of the large tourist events. The Chamber is encouraging Nantucketers to buy online from local stores and to purchase gift certificates for later use. AC Eats, which is ACKEATS.com, offers delivery services for many island restaurants. For businesses without an online presence, the Chamber is trying to create an online marketplace. Managers and owners are encouraged to develop contingency plans should there be a disruption to their supply chain or their workers are quarantined, etc. The 46th Daffodil Festival has been rescheduled. The future date is not yet known. Now begins our scheduled Wednesday Nantucket Pulse update with host Roberto Santamaria.
Good evening. This is Roberto Santamaria, Nantucket's Health Director.
And I'm Libby Gibson, Nantucket's Town Manager.
And we're here for Nantucket Pulse programming made possible by Nantucket Cottage Hospital's Community Health Initiative. This broadcast covers the impact of the coronavirus on the island and provides urgent updates. Coronaviruses are a family of viruses that infect both humans and animals. A subset is known as beta coronaviruses, and they have been causing the world a lot of suffering in the past 20 years. The SARS virus from 2003 is a beta coronavirus. MERS from 2012 is one too, and the one disrupting the world right now is also one. Because they are all beta coronaviruses, they have many structural and genetic components in common, and they all have their origins in bats. However, that does not mean the jump from an animal to a human, called spillover, involved a bat. For example, the spread of MERS might have come from camels. We don't know from which animal the coronavirus in the news today jumped from to infect humans. We also don't know why the virus mutated so much to enable its spillover. The level of change required is like a human mutating to grow a third hand. The similarities of the beta coronaviruses are reflected in their names too. The name coronavirus comes from the Latin word corona, which means crown. Under a powerful microscope, these viruses look like balls with little sticks jutting out around their surfaces, like spikes on a crown. These sticks are called peplomers and consist of several strands of proteins with carbohydrates swirled inside. They are the secret to the virus's terrifying ability to infect human lung cells so ruthlessly. These peplomers are like keys that fit into the outer grooves of our cells, enabling the virus to bind and force its RNA inside. This RNA then hijacks our lung cells, forcing them to switch from producing healthy proteins to becoming non-stop factories for copies of this virus. The virus, on top of everyone's mind today, has been officially named SARS-CoV-2 because it causes severe acute respiratory syndromes and is a type of coronavirus, CoV. It is number 2 because the virus is so similar to the 2003 SARS outbreak that it's like the terrible sequel. In fact, it shares between 80 to 90% of its genetic material, in this case RNA, with the 2003's SARS. The disease it causes is known as COVID-19, which is short for Coronavirus Disease 2019. The 2019 comes from the fact that it was first identified in 2019 in Wuhan, China. It causes mostly respiratory syndromes, similar to the common cold and pneumonia. The virus first appeared among a group of people with pneumonia who were associated with a seafood and live animal market in Wuhan, China, back in 2019. They complained of fever, coughing, and shortness of breath. As they went about their daily lives, their coughing would leave tiny droplets filled with the virus on surfaces and sometimes in the air, wherever they went. It can live on plastic and metal for up to 3 days. The infection spread from these droplets so quickly that soon the Chinese government noticed infections in people that had no contact with the animal market. Now that has spread worldwide. The Centers for Disease Control has now labeled the virus a pandemic. Those most at risk for contracting the virus are those caring for individuals with infections, like healthcare workers or family member caretakers. To reduce the spread, sick people and those in high-risk environments should wear a mask like an N95, wear gloves, and wash hands frequently. If you are caring for someone who has the virus, make sure he or she stays in a separate room and uses a separate bathroom. Reduce contact as much as possible and make sure any contact is done through a protective layer like gloves. You can wash all of his or her laundry with normal detergent, but dry it on high. Don't stop washing your hands either. The state is following the CDC's Person Under Investigation protocol to prioritize testing. The PUI is divided into 8 categories, and they are not necessarily ranked by severity of symptoms. Rather, they are by priority to stop the spread of the virus. For example, Category 1 deals with first responders that have worked around infected patients and have symptoms ranging from mild, like a sore throat, to more advanced. Categories 7 and 8 deal with those who have traveled to places that have had high-risk outbreaks, or those who are at high risk, like the elderly and those suffering from other illnesses, and have a plausible reason that they have contracted the virus. The state strongly encourages Categories 7 and 8 not to use the state laboratory for testing. The more we implement basic measures like hand washing, social distancing, and prioritizing medical equipment for the professionals, the more likely we are to slow the spread of the disease. This way, the number of infected patients won't inundate hospital capacity and symptoms can be managed until a cure is found. And now, some developments from the hospital. The hospital has restricted ER access. Only individuals who have been screened may enter the ER. All other doors, even for staff, are locked, so everyone must get screened before entering the ER. The hospital has canceled all elective procedures and non-urgent appointments. They are asking the public to please not come to the hospital if you feel sick. Rather, please call first so that the hospital can give you guidance. Across the country, testing capacity for the virus is limited. The hospital is only able to take samples from patients that fit certain criteria. They have set up a drive-by testing site only for people experiencing respiratory illnesses. There are no confirmed cases on the island. However, the hospital advises acting as if the virus is already here. They are telling the public to stay home and to isolate. People should not have parties, play dates, and other gatherings. They are encouraging folks to go outside and take walks as long as they maintain a distance from other people. They are also advising people to wash their hands properly, reduce trips to communal places like the grocery store, and to wipe with disinfectant wipes anything you touch in a store. If you feel sick, of course, you should stay home. If the hospital has a surge of patients that need critical care like respirators, there's a chance that they will be unable to med flight those patients to Boston because those hospitals will also be full. The hospital has a limited number of respirators and medical professionals. And now, a message from the town of Nantucket. Here's Libby Gibson.
In response to COVID-19, the town of Nantucket activated its incident response team on Monday, March 9, 2020, to address the many issues surrounding the outbreak. The town is implementing its Continuity of Operations Plan, our COOP plan, to ensure essential services are provided that comply with the governor's various emergency orders that include limits on public gatherings, school closures, and recommendations to flatten the peak of the outbreak by maintaining social distancing, which includes public services. Please check the town's website for up-to-date information at www.nantucket-ma.gov. As of March 17, 2020, Nantucket town and county offices are closed to the public until Monday, March 30th, 2020. Nantucket Police and Fire Department facilities are closed to the public but providing full services. All schools are closed until Monday, April 6, 2020, per order of the governor. Steamship and Highline ferry services continue to operate on normal schedules. Please note, town officials have been in contact with leadership from the Steamship Authority, Highline Cruises, and the Massachusetts Emergency Management Agency to request limitations on passenger service to the island. The town's request is being taken into consideration. The town of Nantucket does not own these ferry services, nor the docks that service them. Therefore, the town cannot limit or alter service. The alteration or limitation of service must either be voluntary by the ferry service operators or through the issuance of a federal or state declaration. Transportation over waters of Nantucket Sound is exclusively regulated by state and federal governments. We have been made aware of a situation in Maine where a very small island, population 355, shut down ferry service to non-residents. The circumstances that allowed for that are not in place for Nantucket. Nantucket Memorial Airport remains open. However, the number of passengers has been low. Public events are canceled or postponed per the governor's emergency order of Friday, March 13th, which effectively canceled all events over 250 persons, and subsequently his emergency order of Sunday, March 15th, 2020, to limit gatherings to under 25 persons. As a result, the town is not accepting applications for new events until after July 1st, 2020. The town asks organizers of events canceled due to the executive order to contact the town's licensing agent, A. Baxter, at police.nantucket-ma.gov to update their event applications should they wish to have their events after this crisis is over. Nantucket's incident response team meets daily at the Emergency Operations Center at the Public Safety Facility to monitor and process new information, issue updates, address personnel and other issues, and the like. Our community members, visitors, and potential visitors are urged to follow the guidelines of the Centers for Disease Control with respect to social distancing, sanitizing, travel, and other measures needed to flatten the contagion. All of these guidelines may be found through the town website. The town thanks the Nantucket community for its patience and understanding as we all work together to minimize the impact of the coronavirus on our island. We are working very hard to issue accurate, factual, and current information as quickly as we can.
So Libby, what would a Nantucketer do?
Well, a Nantucketer could social distance, as we are doing right now. A Nantucketer might go on a walk at one of our beautiful walking trail areas outside, get some fresh air, but again, social distance apart so you're not close to people.
Or I can go to a grocery store, but not between 6 a.m. and 7:30 a.m. because that time is reserved for people ages 60 and older. And also, what should kids do?
All of the schools are issuing assignments, projects, activities to all of their students. They could read a book, even though kids hate books. They might have to read a book. They can play games at their own houses with no friends over. They could certainly go out and play in the yard. The playing fields are open, So they could play there, not in
large groups.
with distances, but kids could throw a ball back and forth. They could meet.
As long as they don't sneeze on the ball.
Yep, they could meet at the field, throw a ball, depart separately, arrive separately.
Now for a few questions from our community. What protocols are in place for the food insecure? Well, as of right now, Taylor Hilst from the Health and Human Services Department is working on organizing a volunteer effort to get food to those in need. We will be putting up updates on our town's frequently asked questions, and we will be putting things up on the town website as much as possible. And what happens if the support these people receive is only to buy certain necessities and those items are sold out? In my conversations with Stop & Shop and the statement that Stop & Shop has released, they are doing their best to maintain a constant stock of those items that are required and supported by WIC, the Women's, Infants, and Children's Program set by the federal government. Unfortunately, logistical issues may prevent these items from being on the shelves during certain times of the day. However, they will be in stock as much as possible. In the meantime, the town of the Nantucket's food pantry has done their best to maintain food items in stock for these specific populations. Now, for the Nantucket rumor mill. Does this virus spread in mosquitoes? No, this is not a mosquito-borne illness. This virus spreads person to person. Also, this virus cannot be combated by the pneumococcal vaccine or the Haemophilus influenza vaccine. This is a different virus and cannot be solved by taking these normal vaccines. Is there anything that you've been hearing that's just kind of ridiculous that you want to answer?
Not today, Roberto, but I'm sure something will come up.
Thank you for watching. We will be back tomorrow with updates on the coronavirus and its impact on Nantucket. We need to be prepared and informed. Do not panic, and please, during this time, it's crucial to get the facts from your local news sources such as the Enquirer and Mirror, 97.9 ACK FM radio, and NCTV Channel 18. This show will now release new episodes every Monday, Wednesday, and Friday night. All episodes will be available on NCTV 18 YouTube channel in the Coronavirus Weekly Updates playlist. Friday episodes will be live on Channel 18 and on YouTube at 5:30 p.m. We are currently in plans to provide alternate versions in Spanish in the near future. Good night. I am Roberto Santamaria.
Meanwhile, I would like to urge people, and I think we all would at the town level, not to stockpile. Stockpiling hurts people who live paycheck to paycheck. It is not necessary. The Stop & Shop is doing its absolute best to get us our food and supplies, and we do not need to do that. So please refrain from the stockpiling.